Gluten-Free Diet. Celiac disease may require a gluten-free diet. Celiac disease, sometimes called celiac sprue or gluten-sensitive enteropathy, is an immune reaction to eating gluten, a protein found in wheat, barley, and rye. If you have celiac disease, eating gluten triggers an immune response in your small intestine. Thanks for watching. Welcome to the Master Health Media channel. Subscribe, make a comment, hit the bell icon, share, please, and thanks. Some food grain antigens found in wheat, rye, and barley are thought to create a toxic reaction in those who suffer from celiac disease, gluten intolerance, wheat allergy, and other health problems. Studies have been inconclusive, but gluten intolerance seems based on genetic makeup, especially in people of Northern European descent. For someone with gluten intolerance, eating foods made with those grains containing gluten, especially wheat, may cause severe gastrointestinal discomfort. The celiac disease commonly requires a gluten-free diet. The same diet is also recommended for those with gluten intolerance, dermatitis herpetiformis, wheat allergy, and some other health problems. The recommendation by your physician for a gluten-free should not be taken lightly, as the immune response to eating gluten can result in permanent damage to the small intestine of people suffering from gluten intolerance. The need for such a diet is determined by careful medical testing and should not be self-diagnosed. This may be especially important for children who need to eat a gluten-free diet. Testing should be done before the diet is used, or the test may be inconclusive or even incorrect in their results. A person already eating a diet restricting glutens would have to reintroduce the gluten into the diet in order for the test to be accurate. This would cause further and unnecessary discomfort. Unless you partake of this special diet, you would perhaps be surprised at the foods you would need to avoid. For children who require gluten-restrictive diets, it is especially important for the parent to fully understand what food products must be removed from the diet. Even Play-Doh, a long-time favorite with children, can be a potential problem if put in the mouth or if hands are not washed after playing with the clay. Many restricted products are easy to recognize, as they clearly would contain wheat bread, pasta, etc., but not all products are as easy to categorize. Among items to avoid on a gluten-free diet are licorice, marinades, herbal supplements, many over-the-counter medications, broth and soup bases, some syrups. Gluten intolerance is more widespread than many realize, and the result is a proliferation of books and websites that contain safe recipes for those confined to this special diet. Diverticulitis. Diverticulitis is the infection or inflammation of pouches that can form in your intestines. These pouches are called diverticula. The pouches generally aren't harmful. They can show up anywhere in your intestines. If you have them, it's called diverticulosis. Symptoms: abdominal pain, fever. A good diverticulitis diet requires a lot of fiber. There are many things that you can do if you suffer from diverticulitis in order to ensure that you do not have any more problems in the future. The best thing that you can do to help your situation is to go on a diverticulitis diet. This will help you stay away from the foods that make your condition worse. A diverticulitis diet is not very difficult to follow, and if you know the dose and do not, you should not have any problems at all. When you are on a diverticulitis diet, your main goal will be to prevent this problem from reoccurring in the future. One of the best ways to do this is by eating more fiber. It has been proven that a high-fiber diet is a great way to prevent diverticulitis. Some of the foods that you can eat while on a diverticulitis diet include fruits, vegetables, and whole grains. Anywhere in between 25 and 35 grams of fiber per day is perfect for a diverticulitis diet. You will also want to remember to drink plenty of fluids when you are on a diverticulitis diet. The fiber that you are eating will absorb water, which will in turn increase the soft waste that is collecting in your colon. Drinking enough water will help to make sure that the fiber does not cause constipation. A diverticulitis diet is a must for anybody that has suffered from this disease in the past. This diet is one of the best ways to ensure yourself of never having to deal with this problem again. Overall, a diverticulitis diet is used by thousands of people across the world that suffer from this problem. If you are having problems with getting started, you will want to consult a doctor so that you know exactly what you are doing. What can't I eat on a gout diet? If you have suffered from gout in the past, or think that you may be in that past, there are diet restrictions that you can follow in order to make sure that you never have to deal with this problem again. A gout diet is one of the best ways to get this problem under control without having to go through too much. A gout diet eliminates food that has high purine. The reason for this is that purine usually causes high uric acid levels in the human body. And in turn, high uric acid levels cause gout. As you can see, this means that if you can cut down on these acid levels which are caused by purine, that you can also cut back on your chances of suffering from gout. One of the most important things that you must do while on a gout diet is cut back on alcoholic beverages, especially beer. You should limit your consumption to no more than 3 drinks per week. You will also want to drink as many fluids as you can each day as a way of diluting urinary uric acid. By drinking 2 to 3 liters of fluid, you should be safe. Consuming a moderate amount of protein will also help to cut back on your chances of suffering from gout. Limiting fat intake will also help your situation. This means that you should choose leaner meats, and prepare foods with fewer oils. Overall, a gout diet is important for anybody that has suffered from this problem in the past. It does not really restrict your eating habits too much, so you should not have any problems following the rules. Just like any other diet, if you have some discipline, you will be able to see the results you are looking for. Welcome to the Master Health Media channel. Subscribe, make a comment, hit the bell icon, share, please, and thanks. Take care and stay healthy. Blessings.